Hello, we are Parkland College dental hygiene students, and we are happy to present this interdisciplinary video. We hope to reach other healthcare professions and better treat patients undergoing radiation therapy.
Here are some objectives we will address in this video. Define xerostomia and treatment options. Discuss cavities, periodontitis, and treatment options. Define osteoradionecrosis, its effects of radiation on the oral cavity, and complications of osteoradionecrosis. Identify side effects of radiation therapy in the mouth. Radiation is used as therapy to kill cancer cells in the head and neck. However, radiation can also harm the normal functional body cells, like the mucosal cells found in the mouth. In addition to common side effects health professionals see in patients, such as fatigue, hair loss, and sore throats, there are many side effects that can occur in the oral cavity as well.
Xerostomia is defined as dryness of the mouth. It is a symptom of certain medical conditions, medications, and is a side effect of head and neck radiation. Radiation-induced xerostomia is by far the most common side effect for patients undergoing head and neck radiation therapy. In xerostomia, radiation therapy damages the fluid-secreting serous cells of the salivary glands, which leaves patients with the inability to produce saliva. For this reason, patients experience a thick and sticky mucus as well as a painful dry mouth. There are three major salivary glands that can be damaged during radiation therapy: the sublingual, the submandibular, and the parotid salivary gland. This can leave patients with discomfort, taste changes, and trouble with speech and swallowing. Finally, xerostomia can cause an increased risk for dental caries and periodontal disease due to reduced salivary flow.
One good way to keep the oral cavity healthy during treatment is to address the xerostomia. A great treatment for xerostomia would be Biotene toothpaste. It contains salivary enzymes that mimic the real composition of saliva. This will help in balancing the pH of the mouth and helping to lubricate the oral cavity. Chewing gum has helped many patients with moderate to severe xerostomia. It has been proven that there are anti-carie benefits when chewing sugarless gum due to the increase of the salivary flow in the oral cavity. Biotene sugarless gum also contains enzymes that bring the mouth to homeostasis.
Saliva has a vital role in keeping oral tissues lubricated and maintaining the enamel structure of our teeth by doing three things: controlling the pH of the oral cavity, remineralizing tooth enamel, cleansing the mouth. In a healthy oral cavity, pH is near neutral, approximately 6.7. If the pH drops below this to a more acidic pH, tooth enamel becomes demineralized. In a healthy mouth, saliva helps remineralize this weakened enamel. However, the enamel structure will fail and become cavitated or form a cavity when there is not enough saliva present to restore this balance. Patients receiving radiation are also at a higher risk for periodontitis. This is also due to the lack of saliva, which cleanses the mouth. This results in an increase of gram-negative bacteria, which is responsible for periodontitis. Periodontitis can be understood as disease of the gums or gingiva, characterized by the progression of bacteria down the root of the tooth to eventually destroy tooth-supporting tissue, including alveolar bone. This leads to recession of the gums and tooth loss. Should the patient lose a tooth during head and neck radiation therapy, they now become at a much higher risk for osteoradionecrosis due to the exposed alveolar bone. In osteoradionecrosis, bone cells are unable to regenerate, causing major complications in the oral cavity, including infection and an inability to heal. For this reason, patients should see a dentist 1 month prior to starting radiation therapy to ensure that there are no periodontally involved teeth present that need to be extracted before starting treatment.
To buffer a decreased salivary flow, the use of fluoride is imperative to reduce a patient's risk of cavities. This is because fluoride works to remineralize teeth. Over-the-counter fluoride products such as ACT and fluoridated toothpaste are recommended. However, prescription fluoride products from a dentist are the ideal products as there is a stronger concentration. It is highly important for patients to visit the dentist prior to radiation to receive prescription fluoride products, including custom trays to apply fluoride. First, take a look into the patient's oral cavity to look at the oral mucosa to screen for inflammation and gum recession. Then observe the teeth and look for suspicious areas that could indicate cavities. Take a sterile gauze square and move the tongue from side to side to observe the lateral borders of the tongue for lesions.
Moving on to some of the other oral side effects to look for in patients undergoing radiation therapy. Often the first acute side effect of radiation therapy is oral mucositis, which can simply be defined as inflammation of the oral mucosa. Oral mucositis will present in the first 2 to 3 weeks in 80% of patients. Oral mucositis is characterized by swollen, red, and ulcerated tissue in the oral cavity that range from mild burning to horribly painful ulcers. This is not only uncomfortable and painful for the patient, but it can also limit speech, chewing, and swallowing. Patients are often prescribed analgesics to treat painful symptoms. Patients presenting with oral mucositis that is affecting their ability to eat should consult with a nutritionist to ensure that they are getting the nutrition they need.
As a side effect of head and neck radiation, patients can experience chronic sensory and taste dysfunction. These neuropathic dysfunctions can occur at the beginning of radiation therapy or may be delayed. Chronic mucosal pain and sensitivity can occur after oral ulcerations are gone. About 2/3 of patients receiving head and neck radiation still have mucosal sensitivity for 1 year after treatment. It has been found that if a patient has little or no mucositis, it is likely they will have little or no lasting mucosal pain. Clonazepam, gabapentin, and pregabalin are neurologically active medications that can lessen pain for this condition, along with acupuncture and low-level laser therapy. As we mentioned before, the lack of saliva in xerostomia can cause taste changes. Taste can return to pre-radiation levels in 2 to 6 months or may be altered indefinitely. The first of the 5 taste senses to go is sweet, which often leaves patients with a salty or bitter taste in their mouth. Since taste and flavor impact food choices, a person with damaged sense of taste may have less desire to eat and therefore an unhealthy nutritional status. These patients should receive dietary counseling and guidance for food preparation. They can also experiment with seasonings and spices that make food more enjoyable to them.
Radiation therapy may cause damage to structures in the head and neck through fibrosis. Several studies have been conducted to explore potential treatment options for post-radiation fibrosis. However, no statistically significant evidence exists at this time. Fibrosis is the thickening of connective tissue in vessels, nerves, and muscles. Fibrosis in the lingual muscles of the mouth can affect tongue function, while fibrosis of the constrictor muscles of the pharynx can affect the ability to swallow. Fibrosis can also cause trismus, commonly known as lockjaw, as well as temporomandibular disease. Palpate your patient at the TMJ and ask them to open and close. Feel for any abnormal clicking or popping that could indicate signs of disorder.
As we've discussed, head and neck radiation therapy can drastically affect the oral health of the patient.
In conclusion, saliva is an essential factor in keeping the mouth healthy. Damage to the salivary glands during radiation therapy can compromise the function of these glands and cause xerostomia. Lack of saliva can cause cavities and periodontitis. Fluoride treatment, a full dental exam, and a cleaning are some ways a patient can ensure that their oral health is in the best condition before undergoing treatment.
Examining the patient's oral tissue allow healthcare providers to document signs of mucosal inflammation. Referrals should be made to the dentist to prescribe needed medications, and a dietitian when this oral effect leaves the patient with the inability to eat.
Sensory dysfunction and post-radiation fibrosis are 2 other oral side effects that health providers can help patients deal with through counseling and referral to specialists.
On behalf of the Parkland College Dental Hygiene Program, we thank you for listening to our video to expand your awareness of the oral effects of head and neck radiation. We hope you are able to incorporate this information into your interactions with patients to better treat them.